Bottom line is, he had to reach out, just so you all are clear, the congressman had to reach out earlier, much more so than the recent media coverage, because he knew he would have to take a position on the House bill, which was in the Education and Labor Committee several weeks ago. Congressman Castle voted no on that House bill in the committee, and he feels strongly that the bill required a major bipartisan overhaul. His record is supportive of lowering the cost of services and care, lowering the cost of insurance. Many of you know that the cost of care, if you pay cash, can be 30% less than if you use insurance. This is a big red flag for the congressman that this process is flawed.
Audio visuals over here I want to pull out. It's like.
I did you in.
That's okay.
Where do you want to put it?
Primary care physician in the Dover-Felton area for 13 years. I see the healthcare crisis in this country from several different perspectives. As a primary care doctor, as a patient, I'm a 10-year cancer survivor. As a middle-aged woman who's struggling with how to take care of an aging parent. Small business owner. I run a small medical practice. I want to be able to buy health insurance for my employees. And as a taxpayer, I get angry about the amount of taxes I have to pay. Based on that experience and some study that I've done over the past few years, I'm here tonight to support a national health insurance exchange and a new public plan option. It will help Americans without workplace insurance. It will give competition to the Wall Street run private insurers. It's our best chance of controlling costs and implementing quality improvements. Okay. This is a multi-payer system that restructures health insurance marketplace for Americans under age 65. The insurance exchange would be a new agency that offers Americans a choice of health insurance plans and also regulates insurers. You're either employed or you're not employed. If you're employed, your employer either provides your health insurance or it doesn't. If it does, you stay with that. You get group coverage through your employer. It's no cost, it's no charge, it's no change. If your employer does not provide health insurance, you can go to the insurance exchange and buy health insurance at group rates. Right now.
Can we ask questions as you go along? This is not.
Right now, present system. Small businesses with 10 or fewer employees, 50% of them do not provide health insurance for their employees. Those people would be able to go to the health insurance exchange and buy health insurance at group rates. The employer may have to pay into the exchange. The smallest employers would be exempt. The House bill proposes that employers who have payrolls of $400,000 or over would pay 8% of their payroll into the exchange if they want to use the exchange. Right now, present system, employers pay on the average 12% of their payroll for health insurance. 8% is a deal. Under the Senate plan, they propose that the employer pays $750 per employee per year into the exchange. Right now, present system, the average health insurance premium for an individual is $7,000. $750 is a good deal. This is a great benefit for small business. If you are not employed, or if you're self-employed, you can also come into the exchange. The worker comes into the exchange and they're eligible to buy insurance. Once you're in the exchange, you may be eligible for a subsidy from the government to help pay your premium. The House plan proposes that people who have incomes 400% of federal poverty level or lower will be eligible for a subsidy to help them pay that premium. And that's based on income. So you go into the exchange. If you get the premium, if you get the subsidy or the credit, whatever you want to call it, you can still buy a private plan. The subsidy goes to you, and you choose which plan you want to buy. You can choose the public plan, you can choose a private plan. So you go into the exchange, you decide what plan you want, whether you want a public plan or one of the private plans, and you get your insurance care. Consumer protection. Any insurer participating in the exchange cannot exclude you because of a pre-existing condition. They cannot drop you if you get sick. And they must put caps on your annual out-of-pocket costs. Exchange is receiving money from you, it's receiving money from the government in form of subsidies or credits, and it's receiving money from the employers. The exchange contracts with the insurance agencies and the public plan and pays them. Caps on out-of-pocket expenses. This is based on income again. Now these numbers are just examples for illustration purposes. None of these numbers are set in stone. But say, for instance, you're a middle-income family. You get insurance, you have to pay co-payments and deductibles and co-insurance. But you will be taxed on how much they can charge you out of pocket based on your income. For example, it might be 2.5% of your income or 5% of your income. Those are all numbers that are in flux right now. Cost control is key. The public plan saves money in 3 ways. Lower administrative costs of a government program. Substantial market power to constrain the prices of medical care and finances. Although savings would also depend on the political willingness of Congress to reduce payments to medical providers. And 3, the combination of marketing regulation and competition from a less expensive public plan would prompt private insurers to innovate in ways that lower costs.
Both a physician and a patient. Now, we see on television advertisements for these. Now that takes me to another issue, and that or encourage the bureaucrats to limit health care to stand between the doctor and the patient, the doctor and me, the doctor and you. Well, people don't know.